Welcome to Health Daily, where science meets everyday life. Today, we're diving into a topic that affects millions of people worldwide and is a cornerstone of your overall health: blood pressure. You've probably had it measured countless times at the doctor's office, seen those two numbers, and maybe just nodded along. But what do those numbers, that top one and that bottom one, actually mean? Why are they so crucial for your well-being? Stick around, because by the end of this video, you'll be able to read your blood pressure results with confidence and understand exactly what your body is trying to tell you. Let's get started. So when you get a blood pressure reading, you see two numbers, like 120/80. These are measured in millimeters of mercury, or mmHg for short. Let's break them down. The top number is called the systolic pressure. Think of S for squeeze. This number represents the maximum pressure your blood exerts against your artery walls when your heart is actively beating or contracting, pushing blood out to the rest of your body. It's the peak pressure during a heartbeat. The bottom number is the diastolic pressure. You can think of D for downtime. This measures the pressure in your arteries when your heart is at rest, in between beats. This is when your heart is refilling with blood. So you have the pressure during the push and the pressure during the pause. Both numbers together give us a snapshot of how hard your heart is working and the condition of your arteries. Now, you might be wondering, what's a good number? Well, the American Heart Association and the American College of Cardiology have established clear categories to help us understand our readings. A normal blood pressure is considered to be less than 120 for the systolic number and less than 80 for the diastolic number. So, anything below 120/80 is the ideal zone you want to be in. Next, we have the elevated category. This is when your systolic pressure is between 120 and 129, but your diastolic pressure is still below 80. This isn't technically high blood pressure yet, but it's a warning sign. It means you're at risk of developing it, and it's the perfect time to start making some healthy lifestyle changes to prevent it from getting worse. Think of it as a yellow light, telling you to slow down and pay attention. After elevated, we enter the stages of hypertension, which is the medical term for high blood pressure. Hypertension. Stage 1 is when your systolic reading is between 130 and 139. Or your diastolic reading is between 80 and 89. Notice I said or. You only need one of those numbers to be in the high range to be diagnosed with stage 1 hypertension. This is where your doctor will likely recommend lifestyle changes and may consider medication based on your other health risks. Then there's hypertension stage 2-sex. This is more serious. It's diagnosed when your systolic pressure is 140 or higher, or your diastolic pressure is 90 or higher. At this stage, doctors will almost certainly recommend both lifestyle modifications and blood pressure medication to get those numbers down and protect your organs from damage. Finally, there's a category that requires immediate action: a hypertensive crisis. This is when your systolic pressure shoots above 180 and/or your diastolic pressure goes higher than 120. If you ever get a reading like this, don't wait. This is a medical emergency. You need to seek immediate medical attention because it can lead to a stroke, heart attack, or other life-threatening complications. So, we know the categories, but why is each number, systolic and diastolic, individually important? Let's talk about the systolic pressure first, that top number. For a long time, it's been the main focus, especially for people over the age of 50. Why? As we get older, our major arteries naturally tend to stiffen and become less flexible, a condition known as arteriosclerosis. Think of it like an old rubber band that's lost its stretch. When these arteries are stiff, they can't expand as easily to accommodate the rush of blood with each heartbeat. This resistance forces the pressure to go up. A consistently high systolic pressure is a major risk factor for cardiovascular disease. It means your heart is working overtime, putting a huge strain on it and on the walls of your arteries. Over time, this constant high pressure can damage the delicate lining of the arteries, leading to plaque buildup, blockages, and an increased risk of heart attack and stroke. That's why keeping that top number in check is so critical as we age. But what about the diastolic number, the bottom one? It's equally important and shouldn't be ignored. The diastolic pressure tells us the amount of pressure in your arteries when your heart is relaxed. If this number is high, it means your blood vessels aren't relaxing properly between beats. They might be constricted or less elastic. A high diastolic reading can be a sign that smaller blood vessels, the arterioles, have narrowed. This constant tension means there's no rest period for your arteries. Even when your heart is supposed to be taking a break, the pressure remains high. This can be particularly indicative of risk in younger adults, under 50. You can even have a normal systolic reading. But a high diastolic reading, and you would still be diagnosed with hypertension. Both numbers matter, and both provide unique insights into your cardiovascular health. Knowing your numbers is the first step, but managing them is the goal. So, what can you do? Regular monitoring is key. Whether it's at your doctor's office, a pharmacy, or with a home blood pressure monitor, tracking your numbers helps you and your doctor understand your trends. If your readings are elevated or high, your doctor will be your best partner. They'll likely recommend specific lifestyle changes. This often includes things like adopting a heart-healthy diet low in sodium, getting regular physical activity, maintaining a healthy weight, managing stress, and limiting alcohol. For some people, especially those in stage 1 with other risk factors or anyone in stage 2, medication might be necessary. These medications work in different ways to lower blood pressure and are incredibly effective at reducing your risk of heart attack and stroke. Remember, managing blood pressure is a long-term commitment to your health. One really important thing I want to stress is that a single high reading is not a reason to panic. Blood pressure can fluctuate throughout the day. It can go up if you're stressed, just exercised, or even just had a cup of coffee. That's totally normal. This is why doctors don't typically diagnose high blood pressure based on one measurement. They'll want to take several readings on different occasions to see if there's a consistent pattern of high pressure. This is also why monitoring at home can be so valuable. It gives a more accurate picture of your blood pressure in your daily environment, away from the potential stress of a doctor's visit, which is sometimes called white coat hypertension. To wrap things up, understanding your blood pressure numbers is empowering. It changes them from being just two random numbers into a powerful tool for your health. The systolic number shows the pressure when your heart is working, and the diastolic number shows the pressure when it's resting. Knowing where your numbers fall within the different categories, normal, elevated, or the stages of hypertension, can help you take proactive steps to protect your heart. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with your doctor or a qualified healthcare provider for a diagnosis and to create a personalized health plan. They are your best resource for managing your blood pressure and your overall health. Thank you so much for watching today. I hope this video cleared up any confusion you had about blood pressure. If you found it helpful, please give it a thumbs up, and don't forget to subscribe and hit that notification bell so you won't miss our future health and wellness videos. Stay healthy, stay informed, and we'll see you in the next one.